Now, I'm just using COPD as an example, but any respiratory disease, and at night, you'll have some issues now, some exacerbations. So, coughing, wheezing, you experience all that. That's going to interfere with your sleep. That's going to delay when you go to bed or when you fall asleep. Will change the quality of your sleep. You know, sleep, it's a process. There are different cycles. I'm not going to bore you with all that. So there's cycles, many cycles that has to happen. You have to go through all of those in order to say at the end of the night, I had a good sleep. Or I feel restful the next day. But because of all these wheezing, coughing, all that, you don't go through the cycles. So your sleep is not as normal as it should. Sleep is inefficient due to permanent arousals. Okay, people with respiratory problems, they tend to wake. The whole body wakes a lot of times during night, and that means you're disrupting the cycles. And again, that will go back to the quality of that sleep. Hypoxemia, you know what that is. The amount of oxygen that you have in your blood. You need to have a normal concentration so you can deliver to all the organs in the body the right amount of, or to help all those processes in the tissue. You need to have that oxygen present. Just because you have sleep apnea, your oxygen saturation will go even lower. And I will show you an example in a little bit. Just because you have that, is nothing you can do. And now, and I'm telling you this, around 15% of patients with respiratory problems have been shown to have sleep apnea. So you add a condition now that nobody knew before. Yeah, I have coughing, wheezing, I can't sleep, I'm feeling tired during the day, and you will blame it that I didn't have a good night's sleep. Yeah, it can be that. But how about this? You might have sleep apnea. You don't know. And this is the example of the desaturations that you can experience, a person with respiratory problems can experience. So this is the oxygen saturation from 10 to 100. Everybody will be around 90, 95, 98, okay? And this is the hours from 11 p.m. to 7 a.m. in the morning. Sometimes, like I said, there are cycles all the time. Look at dips in the 60s, in the 50s, in the 40s. So for periods of time, your oxygen level is so low, 60%. Half of your oxygen is saturated with oxygen, which is not good. Again, I'm not going to go into details in physiology and biochemistry, but all these low amount of oxygen creates a cascade of events, inflammation in the body, protein, like abnormal protein synthesis. There are a lot of things that happen that will trigger cardiovascular issues. So you can see what happens with a person at night who just have a respiratory issue. A little bit about sleep apnea. What's sleep apnea? It's part of an umbrella, like COPD. It's a part of an umbrella. You can have obstructive sleep apnea, you can have central sleep apnea, you can have mixed sleep apnea. The obstructive one is the most common out of all of those sleep disorders or sleep apnea. Like the name says, it's an obstructive event. So at the level of your throat, that, how can I explain that? Like the upper airway, like that little tube, that's supposed to allow air coming in or CO2 going out, it gets collapsed. At one point, some tissue on the top here, let's say the tongue, some adenoids, some other tissues around it, will collapse and will block. Will block that airway. So no air is going to come in. And I'll show you a video in a little bit. You do that multiple times an hour. So when the gentleman said 105 episodes of at least, usually they have to be at least 10 seconds to be diagnosed, That was per hour. 100 times or 10 seconds per hour, that's what? 1,000? How many minutes are these? In 1,000? 10 minutes, 15 minutes? From an hour, you don't breathe. It's no air coming in. That's how it's calculated. So nothing goes in. And imagine this is just when you don't get any air in. But in addition to those 10, 15 minutes, you have every hour for 6, 7 hours a night. Okay, you don't have oxygen in. You have amounts of time when the oxygen level is reduced. I'm not talking just when completely blocked, also is reduced. So you have those during sleep. Prevalence, those are numbers from way back in 1991. They said the prevalence could be 2 to 4% based on the gender. I will show you that 4 probably is for males, 2 for females. If you go into primary care, like people with other conditions, you will see this prevalence getting higher. 33, 40% of patients that are seeking medical care will be diagnosed with sleep apnea. Talking about non-diagnosis, look at that number. 93% of women and 82% of men still remain undiagnosed. So patients walking around, they might have sleep apnea. And there was another number, actually who got diagnosed is just 1 in 50. So if, let's say we are 50 here, 1 got diagnosed, but probably all of us would have it. So it's vastly undiagnosed. And this is the explanation, kind of visual explanation of what happens.
What happens in people with OSA is that the tongue and soft tissues in the airway relax during...
Oops.
What happens in people with OSA is that the tongue and soft tissues in the airway relax during sleep. When the tongue and tissue totally obstruct the airway, it prevents fresh air from reaching the lungs, despite efforts to breathe. The oxygen content in the blood goes down, houses the body from sleep just enough to open the airway. It also stimulates the heart to beat faster and the blood vessels to constrict to send blood and oxygen to the vital organs. Regular breathing is restored, but the cycle repeats itself, sometimes up to 100 times a night.
So I left these variables, those numbers there, just to see what happens. This is one cycle in which oxygen level goes down, heart rate goes up, blood pressure goes up. So you have those 100 episodes an hour of these changes, continuous changes of blood pressure going up, heart rate going up. When in fact, what is supposed to happen during that time? Just stay nice, relaxed, and sleep. But no, your body is doing all these abnormal changes, when in fact it's supposed to go relax and sleep. That was the meaning of the sleep process. The body, when you include this, the body's trying to, if you witness your partner, the body's trying to breathe, to open it up. And it's doing this until the brain is smart enough, but it's clicking after a while. The brain senses it's too much CO2, because if you don't breathe the CO2 out, it's accumulating. Body doesn't like too much CO2. And at one point it's going to say, okay, if we cannot open this, wake up. And by waking up, you do you experience that? Gasping and choking and waking up completely. Sometimes you are not fully awake, like brain awake, to look around and say, okay, what happened? No, but the body itself woke up. And then you go back to sleep. After like 10 minutes, you do another one, depends, what your severity was. So the body's trying, and this is the problem. By trying all of this is changing the normal pattern of the sleep. And this can cause a lot of issues. you will hear the severity. You go to a sleep physician and it's going to tell you your apnea-hypopnea index, that's how the severity is described, is 105. What does that mean? They're talking about apnea, like complete cessation, no airflow. Hypopnea, I'm getting less air, not enough, but less air. But again, it has to happen for at least 10 seconds to be considered an event. And some people, it happens for 30 seconds at a time. 30 seconds, you're not breathing. And I can't imagine for 30 seconds not breathing 100 times an hour. Or 60, let's go 60 times an hour to make the math easier. If every minute you breathe just half of it for 60 times, half of the time you're not breathing. Half of the time you're not breathing. How can you survive that? If I tell you being awake, try to do that, you can't. But at night, this is what happens. So by adding those up, you end up with this apnea-hypopnea index. The severity is described as apnea-hypopnea index above 5. Everybody, young, old, healthy, with sleep apnea, without sleep apnea, they will stop breathing for some periods of time. 1, 2, 3, 4 times every hour. I did this test many times on me with different machines, with all kinds of stuff. I stopped breathing sometimes 3 times, sometimes 4 times, sometimes 2 times every hour. So it's okay. It's fine for the body to stop breathing. It's not going to be an issue. It's normal considering this number 5. Then you go 5 to 14 is a mild sleep apnea. Then you go to the most severe one, about 30. The more severe, the more problems, because of the amount of oxygen that is not given to the body. We consider AHI everything that's about 5, but this is debatable. Now, I'm not going to a sleep clinic, pay all this money, and then the physician, oh, your sleep apnea is 6. This index is 6. Let me put you to this and this. Sometimes being mild can be treated differently. Not necessarily giving the machine, a CPAP machine, or any expensive surgery or stuff. So, depends. Usually, I'm concerned with this, about 25 to 7. That's where the big problem is, and that's where the other consequences are jumping in. Who has sleep apnea? Okay.
Males.
Most likely males.
Fat necks.
Exactly. Big necks. So obesity, because one question that I'm getting constantly is, how come it's more sleep apnea now versus 50 years ago? Yeah, one thing can be because of the testing. We have more clinics that can test for sleep apnea. But what else do we have for?
Obesity.
Exactly. So the more fat accumulation, especially in the upper part, when you lay down, because of gravitational forces, and there's nothing you can do, those are going to compress on that neck.